Few sensations in life are less pleasant than the imminent urge to vomit or even a milder type of sickening nausea. If you have cancer and are or will be undergoing conventional treatment, chances are you already have or will be experiencing some level of nausea. It not only sucks to Ralph, blow chunks, vomit, puke, throw up, if you will, but it can be a very serious thing for the concern of loss of appetite and weight loss in those afflicted by cancer. So, what can you do about it? Well, I am going to present to you today real world naturopathic remedies, tips, and tricks strategies to help with this potentially debilitating or at least annoying side effect. And these, by the way, come from my own personal experience with patients over the years, as well as things that other great naturopathic doctors do. So, who am I? Hi, I'm Dr. Lisa Mateka, naturopathic physician, energy worker, and transformational life coach, and I help those with cancer awaken their own innate healing abilities and navigate back to health to an even better state than before, physically, mentally, emotionally, energetically, and spiritually. So, nausea. Firstly, why does chemotherapy and radiation make you nauseated or vomit? Well, it's a complex chain of events involving the central and peripheral nervous system, but really it's an adaptive and protective response from ingesting potentially toxic or harmful substances. Think about that for a second. But our wonderful bodies are capable of surviving such things. So, what can we do about it? Chances are your oncologist is going to prescribe you an antiemetic drug, which is an anti-nausea pill or injection. And the thing is, why give your body even more chemicals, because that is what it is, and there are side effects despite what they may tell you. So I'm going to provide you with some more options, different categories from herbs to nutraceuticals to homeopathics to just actual strategies and tips to mind body medicine to other services and modalities that you can incorporate. So we're going to start with the herb category, and I'm going to start with ginger. And yes, the most boring. I mean, I absolutely love ginger, but this is probably the one that everybody expected me to say, so I'm going to start with it first. But stay tuned because others may surprise you. So yes, and in this video, I'm not going to get into, the scientific mechanisms of action and too many details. Turns out people don't necessarily like that stuff. So we're kind of going to get straight to the meat, straight to the business. Ginger, you can take this in many different forms. You can take it as a tea. Yes, you can find store-bought tea, or you can make your own by getting fresh ginger, chopping it, boiling it for a little bit. Since it is more of a root, it actually needs to be boiled to make a proper decoction. You could also find ginger supplements and capsules. The ginger chews are nice, beware though, because a lot of those do have added sugars and things like that. But really, ginger in any form can work depending on how much you need. And I won't get into dose with ginger because it really is dependent on how bad your nausea is and what form you're taking it in. And I hope this goes without saying, but before you take any naturopathic medicine, it's good to discuss this with some professional that knows your exact health history to see if there's any interactions with any other drugs or supplements you're taking, as well as if there's any, problems for any other health conditions you may have. So the next one is cannabis. So this one also may not surprise you because it's a pretty known thing that cannabis is prescribed for people with cancer to help with their appetite as well as to help with their nausea. So if you live in a place that has medical marijuana or recreational or whatever, if you know what you're getting, I mean, that is something that can work. But of course, there are other side effects to that one. And there's a wonderful Chinese formulation that works really well. So I'm not a Chinese medicine practitioner, but I do very much, recommend and promote Chinese medicine formulations, and there's an herbal formula that works really well for this. I hope I don't butcher the name. It's Chao Shai Hu Tong. I'll put the words up, but Chao Shai Hu Tong is the formula. And then we have essential oils. So I'm going to share with you some really cool stuff about essential oils that are based on actual studies in cancer patients. So I am going to get specific here with like dosing and routes of administration. So there's a lot of different ways you can use essential oils. And I'll start kind of with the most complicated and I'll kind of get more simple. So you can make supplements by getting your own like vegetable cellulose capsules, and then you can put drops of essential oils in there. Make sure you have a carrier oil. So in one study, it just took 2 drops of essential oil of peppermint or spearmint, and then, fill the capsule, fill the rest of it with a carrier oil. You don't need 2 drops of the essential oil of note, peppermint or spearmint. And the carrier oil can be like olive oil, diffractionated coconut oil. It could be, almond oil, something like that. And then you take it you actually take this capsule with the 2 drops of essential oil mixed with the carrier oil, peppermint or spearmint. You take it 30 minutes before your treatment, and then 4 hours afterwards, and then another 4 hours. So 30 minutes before, then 4 hours after the treatment, and then another 4 hours later you take it, and it'll prevent it altogether. Well, this goes for radiation as well, but the study was particularly in chemo. And then you can use essential oils in steam inhalations. So you could have a diffuser around your home and that may help. Or an actual steam inhalation is like kind of a way to do it is to boil a big pot of water, put some drops of essential oil in there, kind of get a towel and put it over your head, making like a little fort so that you are capturing the vapors and just breathing them in. And you can actually do this with tea as well. You can put some ginger or mint tea bags in there, or you can put also ginger essential oil, peppermint, spearmint in the water and just sort of inhale. I don't have specific numbers for this one. And another thing you can do with essential oils is actually smelling them. So this one I find to be the easiest. So you can, and there's a couple ways of doing this. You can either put some drops on a tissue and keep the tissue in your pocket. That's kind of an easy thing to do, or just bring the whole bottle with you. You can do that. And this particular study, you had to smell the essential oil for 3 minutes straight. So 3 minutes straight, smell it, and that can relieve and or prevent nausea. So in one study that was specifically looking at post-surgical nausea, they didn't need to smell it 3 minutes straight. That was more for chemo radiation. They just needed to smell the essential oil 3 times, and it helped 3 times after the surgery. And then there's another thing you can do. It might be a little more complex. You can make a 3% dilution of essential oil. So what that would mean is you would take like a separate jar, have a carrier oil, olive oil, diffractionated coconut oil, almond oil, argan oil, something like that. And a 3% dilution, so it essentially would be like 9, the ratio. So like say for every 97 drops of carrier oil, there's 3 drops of essential oil. And then you would take that concoction and you would put it on your upper lip, and you would put that on your upper lip about 3 times a day after the chemo is done. You do that 3 times a day, 5 days after, up to 5 days after the chemo, 3 times a day for 5 days after the chemo. And this actually worked really well in every chemotherapy group except cisplatin. So if you're taking cisplatin, this upper lip method may not work, apparently. And then another thing you can do is compresses. You can actually take a mint essential oil, peppermint or spearmint. I believe peppermint worked a little bit better. And you can sort of mix it with some water, some cool water, and put it, soak a washcloth in it and put it over your head during and after the chemo, and just putting it on compress on your head can not only feel good, but that can relieve nausea as well. Or getting a foot massage with it, which you would mix, again, you'd mix this with the carrier oil, and then getting a foot massage with this essential oil. The study was during chemo, also significantly reduced nausea. As for the foot massage, by the way, it was a 20-minute, in the studies, it was a 20-minute foot massage, 20 minutes. And of note, if you are using essential oils to help combat your nausea, it's a good idea to sort of rotate them and not use the same ones, because the body can habituate and get used to them, for one, and also your body can become conditioned to associate that smell with nausea, which can also not be a good thing. But if you rotate them out, that doesn't really happen as much. So some good things to keep in mind. And then something that is suitable, not that the ones I mentioned aren't, but something that I just want to sort of make a note that is pediatrician approved for naturopathic pediatric oncologists. If you are dealing with kids, something that works really well on them is this brand Wise Woman Herbals, and they have something called the tummy glycerite, and that works really well because sometimes essential oils can be too much for kids. Ginger is usually fine for kids, but the tummy glycerite is definitely nice. And obviously the cannabis wouldn't work so well for kids. The Chinese formula, I'm not so sure. So that's why this is a nice safe one for the kids. And then we have nutraceuticals, or basically like nutritional supplements, and some things that can help to prevent nausea, not necessarily relieve it, but if you take these, it can help to prevent it or it to not be as bad, is B6 and probiotics. What kind of probiotics? That's a really good question. And I don't know. And that's the thing, like probiotics, it's just a complicated subject in itself, because what one person should take for probiotics is very different from what a different person should take. And obviously the best thing to do is to get some testing done with a fecal sample, so you know exactly what's going on with your gut microbiome and what kind of probiotics you actually need. But that can be complicated, so I'm just throwing it in there though, because it has been shown to work with some people. Just having, just normally taking B6 and probiotics can lessen having bouts of nausea. And then we have homeopathics. Yes, I'm going through these kind of quick, so I hope you're taking notes. Homeopathics, ones that work really well for acute conditions such as nausea, vomiting, of course, are Nux vomica, Tabacum, Cocculus, I think that's how you say it, Cocculus, and Arsenica album. Arsenica album are some of the big ones. And so the way you would take these typically is 6 or 12C dose, 6 or 12C, and just a couple few pellets under the tongue. And you can do this. If you find one of those remedies works for you, then you should stick to it, and that can immediately relieve people's nausea. It's more of something you do once you already have the nausea versus preventive. But if you find that it works, you can just take it every day that you are going through the treatment. Okay, so this next section is fun. It's some things you don't necessarily have to take. They're just things you can do for the most part. And so this is the strategy section. So one is, it's just a good idea when going through conventional treatment like chemoradiation, eat smaller, more frequent meals. If you eat smaller, more frequent meals, you can have less side effects like nausea and vomiting. And avoid high-fat, greasy meals. That's kind of a good idea to do anyways, but avoiding the high-fat, greasy meals can also prevent nausea and vomiting. It's recommended to sort of avoid your favorite foods while going through conventional treatment, because if you're getting, nausea, vomiting, eating your favorite foods, you can actually be conditioned to dislike your favorite foods. But hey, if you're trying to not like your favorite foods anymore because they're very bad for you and unhealthy, that actually might be a good thing, is to just keep eating them, and then you'll have this nausea association. But just a tip, if you don't want to come to hate your favorite foods, you might want to not eat them when you're at your most nauseated, or just during the conventional treatment altogether. And if it gets bad enough, if you just have a severe, if you're just really affected with the nausea vomiting side effect, you may have to opt for a clear liquid diet. So lots of soups and broths, but there can still be a lot of nutrients in there, protein shakes, things like that, more of a liquid diet, a little more bland. That is something that's, hey, it's a lot better than just vomiting up all your food and being miserable. So this can still be a way to not only get your nutrients in, but to also just not be nauseated and vomit. So you may have to go to more of a liquidy, bland sort of diet. And then if you are taking antiemetics of any sort, I guess I should have mentioned this before, like any sort of anti-nausea, whether it's the drugs or whether it's these natural things I'm sharing with you, it's recommended to take them 30 to 45 minutes before a meal. So if you can sort of plan that, it's good to take it 30 to 45 minutes before a meal. And similar to how it's good to have like levels of B6 and good probiotics in you to sort of prevent the nausea, vomiting, it's also hydration is another thing that can basically prevent this. If you stay hydrated, if you're normally a hydrated person, then you got that working for you. But stay hydrated. Just being hydrated, just in general, is gonna kind of lessen your chances or lessen the severity of the nausea and vomiting. And that goes for mild exercise as well. If you just sort of do some mild, which honestly is a great thing to do for cancer anyways, like 30 minutes a day of walking. If you do some mild exercise, that can actually prevent the nausea, vomiting, or it can, if you're having it currently, just taking like a little walk can in some cases make that go away and make you feel better. So mild exercise is one. So here's perhaps a weird one, an oddball out to this section, something called systematic desensitization. So this is something you may need, a therapist or psychologist to do with you, or it could be something you can maybe learn on your own through a book or something. So what can happen, unfortunately, with the nausea vomiting side effect is cancer patients can end up with what's called anticipatory nausea, where just going to the cancer center about to get the infusion of chemo or whatever can make them vomit, because it's like classical conditioning. Like, remember Pavlov's dogs, where the bell, because they associated the bell with getting fed. All they had to do was hear a bell to salivate, even if there was no food. That kind of sort of thing that happens, classical conditioning. Well, cancer patients can get conditioned to vomit when they're going to treatment, even before they get the treatment. So to combat that, there's a behavioral therapy approach called systematic desensitization, and it essentially uses like a progressive relaxation during the stimulus to just sort of help rewire this behavior. I don't know exactly how it's done, but that's something you can always ask about. Or I guess more accurately, it's learning progressive relaxation as a response to the stimulus, as a response to getting the treatment. Anyway, that's something you can always ask your doctor about, or your psychologist, therapist, whatever. Systematic desensitization. And then we have mind-body medicine, one of my favorites. The category mind-body medicine, it refers to the connection of our minds with our bodies. So basically, this should be not really any surprise. This is basically a lot of your relaxation techniques, meditation, mindfulness, guided imagery, hypnosis, even things like reading a book, listening to music. These sort of things that help the mind and heart be coherent, or these things that kind of get the chatter of the mind away, that just sort of slow down the beta brainwave, things that are relaxing, is going to help you to not have nausea as much. It kind of makes sense. And then we have the category I'm just sort of calling other modalities or services, because some of these are services you would have to seek out, and pay somebody. These are things like acupuncture. Acupuncture is really helpful for this. And anyways, it's a really nice complementary therapy to cancer treatment. Apparently PC6 is one of the more common points for relieving nausea. PC6. And going along with acupuncture is also acupressure. And there's actually these things you can buy. They're only like 20 bucks or so online called C-bands. SEA bands, and they're these acupressure wristbands, and they kind of compress these certain areas that help to, relieve nausea. And apparently they work pretty well. Those real people have really good results with those. So that's actually, I think, a really cost-effective and cool thing to do. Get these acupressure wristbands called C-bands. Look them up. It's a company. Kind of any kind of acupuncture, acupressure, electroacupuncture as well, where they just kind of zap the points. That can work. Massage can be another really helpful modality, and that's just such a nice thing to have anyway. And I think that also could have been in the mind-body medicine category because it's a relaxation thing also. I hope you got some good tidbits and nuggets there. My goal was to keep you empowered and informed. Most oncologists, they just don't know this stuff. So they're going to present to you some very limited options and a narrow view. And we don't want that. We want choices, options, that freedom. We want safe and natural alternatives. So I hope you found that valuable, and thank you so much for tuning in, and I wish you the best with your journey. Please follow me on this Rumble channel, like, comment, all that kind of stuff helps the algorithm because I want this to reach more people because I really do want to serve. And there's another way I can serve you. If you want a free gift, just look in the description box and you can click on a link and get my free article, 10 Common Healing Factors Among Cancer Survivors Who Beat the Odds. Pretty self-explanatory. And there's also an application for my coaching program. So thank you all so much, and bye-bye for now.